Can you guess what my patient had? I had a patient that was 46 years old. She came in and she shared with me that she had been feeling fatigue and tired for several weeks. She also noticed that she was having a hard time concentrating on just regular tasks, even after a full night of sleep. And the other thing that she shared was she was having this feeling of hot and cold happening throughout the day. It didn't matter what time of day, where she was. One moment she felt hot, and the next moment she felt very cold. And so, as I'm talking to her, I was asking her, any family history of anyone in your family with similar symptoms or any diagnosis? And she said no. And then I asked her about her own personal history, and she shared that she has not been diagnosed with any health problems. She's not taking any new medicines, and she had never experienced anything like this as well. She had a healthy diet, she was active, and so forth. So as I was talking to her more and more, I asked her, I said, okay, let's start with a couple of things. I just want to make sure that you don't have mono. You're feeling tired. You've got, just this constellation of symptoms. Let's check it. Number two, I'd love for you to pee in a cup just to make sure that you don't have a bladder infection, because sometimes you can have an infection that's brewing and that can make you feel tired and so forth. And the third thing I asked her, I said, you know what, I'd love to check you just to make sure you're not pregnant. And she was like, oh no, I haven't had a period in 6 months. I'm in my 40s. There's no way that I'm pregnant. So I shared with her why I wanted to test. And this part's important. As a doc, I find it so important to always share with my patients why I'm ordering something, why I'm thinking something, and then ask them, are they okay with that? Because for me, this is a shared decision making. And if it's something that you're not comfortable with or you don't feel like it's the right fit, I'm not going to order it. So as we were talking and I shared why I wanted to order those tests, she was like, okay, let's do it. So we checked the mono. The mono was negative. And then I had her pee in a cup and I checked to see if there was any infection, if there was any blood, anything of the sort. And it looked perfect. There wasn't any findings. So then we checked a pregnancy test and surprise, she was pregnant. And she was taken aback. She said, this is not possible. I haven't had a period in 6 months. So let's talk about what she thought she was experiencing. She thought she was in menopause. And so how do you know if you're in menopause? Technically, it is 12 months without a period. So if you've gone 3 months and then all of a sudden a period shows up, you're not in menopause. If you've gone 11 months and all of a sudden you get a period a week, so 11 months and 1 week, you're not in menopause. So it's always important to think about all of the different options that could be why you're experiencing certain symptoms, and also to think outside the box. And I encourage everyone to make sure whatever clinician that you see, that they're willing to hear you, listen to you, and also explain why they're ordering what they're ordering.